everybody. My name is Tiffany. I am, one of the student nurses at NTC here taking care of you. How are you doing today? Good. That's great. So I was checking your orders from your physician, and some blood products. Some blood was ordered to be administered in your IV line that you already have placed here. So we're going to go ahead and do that shortly. I just want to ask you a couple of questions first. Can you give me your full name and date of birth, please? All right, yep, Betty Jones, 52152, great. Have you had blood products before? No? Okay, so, all right, so with the blood products we're administering is because of your low blood count that, from taking that lab work earlier that we did. So we're trying to replace some of those blood cells with that blood. Now, for transfusion reaction, which is fairly rare to occur, could come up as, you know, some lower back pain, maybe some difficulty breathing. You could have some itching, maybe a fever, and so I would want to know that right away. So if you are feeling a little bit uncomfortable or there's something that just doesn't feel right, please let me know as soon as possible. Okay? Great. Do you have any allergies at all? Okay. And you're able to follow commands just fine. You're able to sit still while I do this, get this blood hooked up for you. All right, perfect. So first off, what I'm going to do is go ahead and take a full set of vital signs to include blood pressure, pulse, respiratory rate, your temperature, SpO2, and I'm also going to listen to your lung sounds here. So I would listen underneath the gown. Here too. And then I would go ahead and listen to your back as well, your posterior. Okay. So I will be in here for a little bit after we start the blood for about 15 minutes because the likelihood of you having any reaction will be within this first 15 minutes. So I'm going to stay in here with you during that time. As of right now, I'm going to go ahead and get your blood and get everything set up and checked off first. And so I checked the order for the blood administration, and you had signed the consent form with the physician when he was in here earlier, consenting to you receiving the blood, and she confirms, but I will double check that again before I administer the blood. Perfect, so I'm going to get that stuff ready, and then once I have that ready, I'll be right back, okay? All right, so and Ms. Jones already has an IV, a 20 gauge in place, and actually I'm going to go ahead and just confirm patency with that IV before I get started here, because I don't want to have the blood sitting here more than 30 minutes. Okay, so I'm just going to double check your IV, and you don't have any allergies, you said? All right, perfect. So I'm going to go ahead and clean for 15 to 30 seconds according to agency policy. Got my normal saline. Any of the bubbles. It's within expiration. I don't feel any edema to the area. It's flushing very well. You don't have any pain when I put fluid in your vein? In the IV? She says no. Okay, perfect. So it appears to be patent and ready for use for the blood. All right, now in here. All right, so it doesn't seem that I need, looks like packed red blood cells. I don't need any warmer, any special filter for this. So I'm going to do my double checks here. I just confirmed my order for the administration. I also confirmed that the consent form has been signed by the physician and the patient for blood administration. Now I'm going to do my checks with another nurse to do my blood checks to make sure I have the appropriate.
Okay, I'll play the second nurse.
Okay, so here we have Betty Jones. Betty Jones, 5/21/52.
Okay, confirming Betty Jones
All
and the
right.
correct birth date.
All right, and medical record number. Medical record number 224466.
224466.
Okay. Account number 123456.
Account 123456.
All right, we have Betty Jones. Red armband number is 456654.
Red armband number 456654.
Perfect. And this is B positive blood.
Patient blood type is B positive.
Excuse me. Yes. Packed red blood cells. B positive. Donor number is 7890.
Donor number 7890.
And we have 4 units in the pool.
4 units in pool.
250 milliliter volume.
250 milliliter volume.
And this is packed red blood cells.
Packed red blood cells.
Expiration date 5/22/20 at 2000.
Expiration date 5/22/20, 2000.
All right, and blood type O positive.
Donor blood type.
Donor blood type O positive.
Donor blood type O positive.
And compatibility test was done on 1/2/20.
Compatibility test completed 1/2/20.
Accession number 1.
Accession number 1.
Okay, so I've done my my checks here and confirmed the right patient, the right blood for that patient, my double checks. I'm just looking to inspect the blood. I don't want it up here in room temperature for more than 30 minutes. I want to check to make sure there's no clouding, no clumping, any concerns that I would have with the blood in the bag. I have my normal saline here, which is the only thing that can be administered with the blood, as well as my blood tubing, and the blood does not need any special filter or warm or anything, so I don't have to worry about that. Okay, I'm going to go ahead and get this ready to go here. So I'm going to excuse me. Angled here. So start with my normal saline, and this also is clear, it's not expired, and I have the right solution here. So I'm going to go ahead and prime my tubing here so that I don't have any air bubbles. And make sure that my chamber is filled above the filter level so that it doesn't damage the blood cells that will be going into that filter area for the chamber. Okay, and then I want to go ahead and clamp. So I have that clamped. I can just double check. I did my checks already with my other nurse, and it hasn't been longer than 30 minutes. And the blood has been up here. I can just gently agitate the blood. Again, looking to make sure I don't see any clumping, any discoloration, or anything that would be concerning. That I would not want to use it for the patient. And I can go ahead and I'll go ahead and open my tubing here for my blood, and I want to flush the blood through the tubing until it's almost at the end. And I have my normal saline locked. So we'll just say that the blood is primed to about the end there, and then I can here, and then I will leave it open, and I'm going to clean the port, and then I can start the blood. So I'm going to go ahead and clean according to agency policy, 15-30 seconds. How are you doing, Miss Jones? We're about ready to start this this blood, so just let me know here if you're feeling anything different or you're feeling yourself. Blood, this is red blood cells. Blood cells, this is correct. Rate, I want to start this at 50 milliliters an hour. Volume to be infused would be, this is 250 milliliters, I'll do 240, so that way it doesn't dry out the line. And I'm starting a little bit lower rate here, so that way I can monitor the patient's response to the fluid, and then if need be I can increase as long as the blood gets in within 4 hours. So now I'll go ahead and the lines are open, and I can start. Everything looks good. Alright, so then I go ahead and I already did my patient's vital signs beforehand, so I would stay in the room with the patient for 15 to 30 minutes, and after 15 to 30 minutes, I want to go ahead and take another blood pressure, get a full set of vital signs, do an assessment, listen to lung sounds. If I was concerned about an transfusion reaction, I would go ahead and stop the blood infusion right away, and then I can get a normal saline and tubing, and then hook that up to TKO to keep the vein open in the site. I would then want to assess my patient and notify the physician, and then follow up with whatever is needed or ordered for treatment for symptoms, or whatever the physician may order, and then follow my agency's policy and how I would manage that after that. So right, I can go ahead and listen. We'll just say it's been 15 minutes. I'll go ahead and get a full set of vital signs, blood pressure, pulse, temperature, respiratory rate, SpO2, and then I can go ahead and listen to lung sounds again under the shirt. I listen for a full respiratory cycle in all locations, anterior and posterior. Posterior as well, which I just did. Alright. Okay, so let's just say that this was infused. I don't have any issues or indications of a transfusion reaction. Everything looks good. This unit is done, so then what I would do at this point would be to I'll just put we'll just I would then clamp the tubing, make sure that I have my normal saline open, and then I would go ahead and basically flush this line out. With normal saline until I have all the blood out of the line. So that then I would just discard of the blood tubing and biohazard or whatever the agency policy is for that, in the appropriate receptacle. All right, then I would, after I'm done with the transfusion, I would definitely want to reassess the patient again, do another set of vital signs, check lung sounds again, make sure the patient tolerated the procedure okay, and then I could again dispose of all of my equipment. Discontinue my line. I would flush the line, the IV line, with the normal saline, and then I would go ahead and document. So I document the information on our blood tubing. So the blood type, infusion rate, infusion time, blood component, any of the other documentation that agency policy would require. So the information that would be on the blood bag, how the patient tolerated it, time it took to administer, any reactions, document my vital signs, and I would wash my hands upon exiting after I got rid of all of my equipment.